This is Dr. Vaishali, and I'm reading from the book Substance of Homeopathy, chapter number 29, period 4 or second line of matter. Name of medicine is Palladium. In the fifth period, we have two remedies which are commonly used, which is Palladium and Argentum. In my experience with the Palladium, I found that these people lay a great emphasis on what other people think about them, and they always try to get the good opinion of other, to which they attach great importance. And if they don't get that good opinion, then they feel insulted. The rubric is diligence is not appreciated and feel neglected. One of the rubric of Palladium is delusion that he is neglected, and this is very strong feature of Palladium. This remedy one of the remind this remind one of the Argentum nitricum feeling. Delusion is despised or 4-second feeling sensation of isolation. The main feeling these people is that if they do not do good enough, if they do not do well enough, they will be neglected and they will not be wanted, and this deserted 4-second feeling becomes strong, and so they always need to do something in order to win the appreciation of other people. The main feeling on this saying that the Palladium patient is what is nice person she is, how good she looks, how well she talk, how well she manage, how well she does things, etc. They want to listen like this way. I remember one woman who had come with a complaint of asthma, extensive lichen planus. She would sit with a tremendous air of authority, but in a very nice way. I found that she was very strong-willed, but she appeared very friendly. The rubric is obstinate, try to appear amiable. This woman used to live with her husband in a joint family and with her father-in-law and mother-in-law. She is quite an egoistic person, and this delusion enlarged is very tall, and though she does not externally appear so, and she tries her best to win the appreciation of his father-in-law and mother-in-law. What she felt most disturbed about was that however much she did, he didn't praise her, and it was the praise from him what she craved. And so rubrics are flattery desire, longing for the good opinion of other, haughty, wounded wishes to be flattered, delusion that she is not appreciated, offended easily. And second medicine is Argentum metallicum. We have already discussed the theme of Argentum metallicum, which is very close to the Palladium. In the both try to perform, but here the performance is more with their talking, singing, and expressing. These people often become a famous singer and a speaker. It is a psychosyphilitic remedy which has two sides. On one side, talkative, hasty, jumping, laughing, less restless, and on other side, disinclined to talk, tired, forgetful, etc. Beside this two-phase, one thing is lack of control, doing uncountable things, and another is deceitfulness. And physical symptoms are electric shock, convulsion, and cramps. But at the same time, it has got thickening of the cartilage and symptoms that are deep and penetrating. So, close remedies are the alumina, mercurius, selenium, and other metals. All these remedies have a common deep penetrating process with sudden acute exhilaration and violent impulse and manifestation. In Argentum metallicum, one of the most important symptom is aggravated using the voice. Aggravated from speaking, singing, mental exertion. From this, we know it is a remedy for the teacher, professor, or who use voice and mind and are compelled to do things, but on the other hand, they can give up from too much of this, for their voice is lost, mind stop working, and there is an alternation between the loquacity and sadness. They are in the chronic situation in which they are forced to perform. Silver is showpiece of human society. Speech is silver and silence is golden. Speech is show, constant need to show, mentally and by speech. It is an impossible situation because they can never ever meet demands and therefore they become a depressed. The patients alternate between the performance and the failure. When he feels forced to perform, there is both anger and fright. This fright is what is shared with the argentum nitricum, which has anxiety before performance. In anger, there is rage, and when provoked, he can react with a striking. For example, cough from anger or jerk. He can go out of control. He loses his balance and control. Slowly over time, the mind and body give up struggle and go into the deep-seated degeneration. He developed vocal cord nodules, so may never be able to speak well again. His cartilage and condyles become thick and so cannot move again. Limbs feel powerless, become tired and weak. Emaciated, loses his mental power and become almost insane. So, his organ of performance, which are mind and voice, limb and joints, are the chiefly affected. A person who use logic and intellect more and like to show to demonstrate his skill, his expertise, his knowledge, a professional speaker, that is his job. He lecture and reads and gives lecture. There are people who talk less from experience and more from the performance angle. Big orator, public speaker, clergyman, and preachers. He is a man who is compelled to perform. He is a performer. He come in the class same as a musician, as a singer, as a writer, as a novelist, even a newspaper editor. The same quality, the need to show, need to use intellect, the words, the talent, like highly intellect and poor emotions. He can rationally analyze and put things very clearly and argue it very well and use logic for it. He is the one who is quoted. Quotations come from him because he is good at speech. We have to take any real like example of this, and we can take a example of Winston Churchill. To the same class belongs Norman Vincent Peale, great speaker, great singer. Silver is a showy metal. It is a shining, silvery. Silver is for show. A good orator is called silver tongued. Funnily enough, Argentum metallicum has a symptom. Tongue has a silver coating. It is said silence is a golden, speech is a silver. Silver is not so noble, but is always very showy. This is the positive side of the silver. It has the negative side too. The opposite is that it loses the power of talking and intellect become dull and the voice crocked. The person loses his control and get writer's cramp, paralysis. His limbs lose control and power, and so there is a feeling of want of control and want of power. Just as aurum metallicum has extreme polarity between high morality and extreme guilt and suicide. Argentine metallicum has a polarity between high performance and tremendous lack of confidence in performance. He cannot perform because he has no control on his mind, on his voice, on his hand, and on his movement. Example, exact organ of the expression, exact expression of the soul. And how does this process take place? It doesn't take place in a day. It is a it's a slow and chronic remedy. Just as silver get darker and darker if you keep it in exposed. So also the process of argentum metallicum are slow and chronic, and things get worse and worse. So see the two opposite sides in argentum metallicum. On the one hand, you have a great inclination to talk, his mind is very clear and he argues with the facility, and inclined to laughter and loquacity. And on other hand, you have the opposite. In society is indisposed to talk, increased cheerfulness and disposition to talk. This is the rubric. And displeased and aversion to talk is second one. And one hand, paralytic weakness. And then the opposite is much inclined to move, feel as if she had more power. In India, there are many kind of music. One of them is classical music, completely intellectual, completely mathematical. The person only uses his vocal cord, and knows how to manipulate them to produce most wonderful notes. But there is no heart in it. It is only a play with the vocal cord. So you have singers' nodules and hoarseness of the speaker. They have to clear their throat frequently and bring out thick white expectoration. Loss of control over mind and body, and that is what singer complain. I don't know. Nowadays, I am not having control over my voice. The voice breaks. It has lost its timbre. The speaker will say, I have lost my control over my voice. It cracks. The writer will say, I don't have control over my writing. I don't know why, when I write, I suddenly get pain and handwriting is disturbed. The piano player will say, I don't have any more power in my hands. There are the kind of people who will need argentum metallicum. Voice, larynx, and extremities are the most important seat of the action of the argentum metallicum because these are the organ of show. A situational materia medica. Argentum metallicum has been forced by his parent to perform, to be a performer, to demonstrate his intellect, his skill, his talent, his brain power. Parents say, "My son, you are okay if and only if you show the world how talented you are." Given this kind of expectations, the persons try to do the best things and talk, sing, preach, but at a point he can't do it any longer and he collapses. The voice is lost, the power is gone, he cannot live up to the expectations, and so he alternates between I am a highly performer and I am a not good enough. And in aurum metallicum, there is a it alternate with a I am highly moral and highly immoral and seen away the day of grace. Now in argentum metallicum, he feels that I am useless. Either his intellect is highly developed or he can't remember and he confused and has loss of mental power. So everything in argentum metallicum is about mental power. The child is expected to have a high mental power and to demonstrate it, show it, express it. Kant says it single out mainly the intellectual faculty, it scarcely affect the emotions. Argentinum, and now I'm reading Argentinum nitricum. The theme of Argentinum metallicum is modified in the Argentinum nitricum, where again there is a feeling of being neglected and despised. The rubric is delusion despised he is. If he does not perform, matlab, delusion thinks he is repudiated by the relatives. The main difference is that in the Argentinum nitricum, the performance is expected at the time of crisis, and the rubric is fear or of ordeal. And in Argentinum nitricum, patients are what I call the ideal crisis manager. They are troubleshooter of the highest degree. In fact, they arrange their whole life in such a way that there is never ever crisis end. And if one comes, they either become a very flustered and panicky, or keep total control and manage it very well. The theme of Argentinum nitricum is therefore the performance under crisis, which needs great control, and this can be seen in the rubric: fear of high places, fear of narrow places, fear when anticipating an engagement, hurried time to arrive at the appointed, anticipation ailment from, fear of failure, diarrhea from anxiety, fear of falling. I have observed that Argentinum nitricum people are especially particular about planning and confirm their appointment once or even two, three times before arriving at place. They are very punctual as they have anxiety when time is set, and they arrive usually quite some time before their appointment time. When they come in, they sit as if ready to start running, or though they are about to begin a race. They are quite hurried and impatient in the movement. The one of the main word that I have found for Argentium natricum is the word suspense. They either crave for suspense or they can't stand suspense, and sometimes for both. Example, a man whose life is absolutely planned to the very last detail is interested in a book by Ludlum with high suspense. They like challenging job in order to overcome fear. I remember one case where a man worked in a bank and he had a very high pressure job. He was a successful banker but kept changing his job every couple of years. When I asked him why he changed the job every 2 years, he said, I usually accept only a very high tension job, and by 2 years I have organized the whole things, and then there is no suspense left anymore. So I take up another job where I don't know anything. The dream they have are to do with the falling from high places, get trapped, and the main theme, fear that they have in the fear of losing control. In his critical situations, rubrics is fear of losing self control. They are very performance oriented.